Coming up next on Arizona Horizon, we'll get Democratic leadership's take on the just-ended state legislative session. Also tonight, a medical expert says there is a way to rescue the U.S. healthcare system. And we'll hear about a new method to determine the cost of a major oil spill. Those stories next on Arizona Horizon.
Arizona Horizon is made possible by contributions from the Friends of Arizona PBS, members of your PBS station. Thank you.
Good evening and welcome to Arizona Horizon. I'm Ted Simons. The state legislature's 2017 session is over. Tonight, a recap from Democratic leaders with a review from Republican leadership set for Wednesday. Joining us now is Senate Assistant Minority Leader Steve Farley and House Minority Leader Rebecca Rios. Good to have you both here. Thanks for joining us. This is our last time now for the session, so again, appreciate you showing up throughout this session to talk about this kind of stuff. Your thoughts on this session?
Oh, so many disappointments. The disaster for our education system is massive, that particularly the voucher bill that went through and now gives universal private school vouchers for every student in the state. It's going to devastate our public schools, taking $5,400 per student out of our public schools and give them to parents with no means test whatsoever to be able to spend however they want to in a homeschool or a private school, presuming they can come up with the extra $10,000 to $15,000 a year in order to do it. It's a massive redistribution of wealth from the have-nots to the haves.
Governor says, though, it's just a start. Let's let it play out, see what happens.
Well, you know, I go back to the day the governor gave the State of the State address, and he must have given us 12 different ideas and promises about what he was going to do for public education, and the final result was, it was an embarrassment. He ended up giving a 1% teacher pay raise that actually isn't even a pay raise. Those in the education community and teachers in particular are concerned that it's nothing more than a temporary stipend because it doesn't go into their salary baseline. The governor, as you recall, had talked about full-day kindergarten. That didn't materialize. The ESA voucher issue was a big problem. He also went into teacher certification. Again, kind of a smoke and mirrors attempt, I think, to distract folks from the fact that we need to pay teachers more, and that's why they're leaving the state. We don't need to change the certification process.
And yet the governor is celebrating what he calls an education budget. Prioritizes education, he says, boosts teacher pay, maybe not by much, boosts teacher pay, invests in universities, all without raising taxes. He has said this on numerous occasions. Is he wrong?
Boosting teacher pay amounts to $18 per paycheck before taxes and any payroll deductions. That's not going to stem the teacher retention crisis, where 44% of teachers leave after 2 years in Arizona right now. Other states are coming into Arizona to recruit our teachers after we train them and give them a whole lot more money to go elsewhere. This is a major crisis, and he's not dealing with it. And what's really tragic is that he had the opportunity. As Democrats, we insisted on 4% teacher raises. You know, just for perspective, it would take 7% teacher raises just to get us to 49th in the country in average teacher salaries. And we had ways of paying for it without raising taxes, but he refused to even meet with Democrats because he was so partisan, he didn't want to talk with us.
And yet, we've heard that you insisted on the 4% increase as part of maybe becoming a player in the university bonding. He didn't want any part of that. You didn't want to soften up on the this is the reports now, didn't want to soften up on the 4%. So instead of working with Democrats, he works even further to the right with conservatives, and a whole bunch of stuff that you guys aren't happy with at all comes to pass. Did you overplay your hand?
We didn't actually have a hand to play. The reality was, I took it upon myself to call the governor's cell phone and say, hey, we're ready to negotiate if you're ready to get something done. I think it was only because that was reported in the news a couple times that he actually picked up the phone, invited me to his office, but it was a very non-committal conversation where I told him we wanted to fight for a 4% teacher raise. I mean, he was very kind, but very non-committal. And nothing ever transpired following that, 10-minute meeting. What ended up happening, though, and this is politics, at the end of the day, we're smart enough to know that that was just a ploy to have the Republicans see Democrats go to the governor's office so that it essentially scares the Republicans into line. He was able to buy off Republican votes very cheaply, $2 million for the Koch brother freedom schools, the propaganda schools, essentially, and some other items that some of his members wanted. And so the loser in that, teachers and education. So did we overplay our hand? We offered up a 4% teacher raise as a starting point and never even got a response.
And yet politics is the art of the possible. Again, I ask you, did Democrats overplay it?
Absolutely not. As we went into this process, we knew that we had something he wanted, and we had something we wanted. And we made very clear, it wasn't just us, it was teachers all over the state saying, we are in crisis here. Your 0.4% raise, that's what he originally came out with in January, was an absolute insult. $15 a month before deductions and taxes. There's no way that's something they would ever see as a legitimate thing. So it's a non-starter unless you really talk with us about it. The fact is, the Republicans control the legislature and they control the governor's office. And they're not going to, out of the goodness of their heart, negotiate with us if they can figure out on their own how they can get what they want anyway. I think the people ought to stand in and change that equation.
I'm going to ask you about that in a second. You still voted for the university bonding bill, correct?
I did, because as soon as the governor proved that he got the votes for this to be able to pass, all of us Democrats have always supported universities and good union construction jobs, and that's ultimately what it was, and that's what I voted for, because I always vote for whatever the benefits of the bill are.
And you voted against the bonding bill.
I did, and I think it's important. They tried to play Democrats as somehow opposing universities, and that's just nonsense. I hearken back to 2 years ago where it was Democrats that were fighting against the $100 million cut that Ducey made to universities. But from my perspective, we have so many education needs that need to be addressed. We're under a lawsuit for not funding schools that are literally falling apart, a lawsuit that was brought against us 25 years ago. We're now in round 2. We're ranked 50th in the nation in per pupil funding, 50th in the nation in teacher pay. So from that perspective, when I looked at that hierarchy of needs, that fell third on my list, and so that's why I opposed that.
What do Democrats now concentrate on moving forward?
It's education. I mean, if you ask most Arizonans what is the #1 pressing issue in Arizona, it's education. And I think what we saw this education governor do is really rally teachers and the education community. We've never seen so much participation and engagement and rallies and teachers filling the gallery on a weekly basis. That is going to continue. And I think you saw with teachers announcing their referendum to do the repeal on ESA, he's kind of poked the bear, and I think he's woken up teachers. And so I hope that that continues, and that as Democrats we can continue to amplify their voice and this issue, because it needs to be addressed.
How do you convince folks that Democrats can get something done? Because it just seemed like, again, that the narrative is you got played a little bit, you overplayed your hand. Whether or not you agree with that is one thing, but that is the narrative. How do you convince folks that you can make a difference down there?
Our hand was maybe 6 high. We didn't have a hand to play that was going to be able to do anything because we don't have the numbers at this point. But what we do as Democrats is point out what could happen if things were different, if different people were in charge. And that's something in which every dynamic would absolutely change. One of the things I did this year is I worked with a very conservative chair of the Senate Finance Committee, David Farnsworth, and I got him to co-sponsor one of my bills to look at the $13.7 billion a year we're giving away in sales tax loopholes, 331 of them in our tax code. I got that through the Senate 28-2 until it ran into a partisan wall in the House. That's something which not only we have to deal with and let the public know that we're more interested in a fair playing field for everybody, even the little guys, but also a source of funding for actually rebuilding our education system the right way.
You mentioned changing the people in charge. You running for governor?
I will be making an announcement on June 5th in Tucson. I hope people will like what it is.
What about an announcement tonight on Arizona Horizon?
In its own time. I'm happy to come back after June 5th.
All right. We'll hold you to that now.
Absolutely.
All right. Good to see you both. Thanks for joining us. We do appreciate it.
Thank you.
You are watching Arizona Horizon. Up next, one medical professional's idea for fixing our healthcare system.
I came to the United States when I was 24 years old. I did not speak any English. I felt very, very lost, really not knowing what to do with my life. One day on TV, there was Sesame Street. Ernie and Grover and Cookie Monster, and it's not only that I learned to speak in English, now I know how to live in the United States, so this is how you do it. Now I'm powerful. Now I know I can do anything I want. I will make myself learn how to do it. And I got that from PBS. I bought my first set of paints and brushes, and I practiced. My path is children's books, and I have found who I wanted to be, which is that person who has something to say. PBS and Sesame Street, they open up the world to me.
Emeritus President and CEO of the Mayo Clinic, Dr. Dennis Cortese, attacks a big problem in a new book he co-authored. The book is titled Rescuing Healthcare, a leadership prescription to make healthcare what we all want it to be. Dr. Cortese is now the director of ASU's Healthcare Delivery and Policy Program, and he joins us now. Good to see you again. Thanks for joining us.
Good to see you, Ted. Thank you.
Rescuing healthcare. Why does healthcare need rescuing?
Would you like to be admitted to a hospital tomorrow?
Not necessarily.
How would you like to be sick tomorrow?
Not at all.
How would you like to be a patient tomorrow? Somebody who long suffers and long endures.
You know that answer.
That's right. We've talked a little bit about that before. But that is the strategic plan for healthcare this century. It's just that simple. And that is, how do we create the answers that you just gave? No, try to avoid a hospital if I can. 2, I'd prefer not to be sick if possible. And 3, I'd prefer not to be a patient. I myself have 5 chronic medical conditions, and I want to be active and functioning well. They can't cure any of them, but I want to be able to not suffer long to make that work. So, how are we going to get there from here? That's a strategic direction. Leadership comes in to make that happen. The key to helping correct the delivery of healthcare. I'm not talking about solving an insurance problem. Politicians are still struggling to do anything just about insurance. We have a lot of people with insurance that aren't getting the best care, the best coordination, the best outcomes. So insurance all by itself does not solve the problem. That's one piece. And politicians, as you alluded to just before, they sort of accomplish the possible. Leaders have to accomplish what seems to be impossible. There's a difference between a leader and a politician. And leaders have to look at, here's the future, and here's where we are. How do we get there from here? And the first role, particularly for healthcare, is if we can get the key leaders, and I'm not talking about just one group. There are many, many people that have to have a shared vision of just what you said. What are we trying to aim for? And once you can create that shared vision, the next level of leadership, role for leadership, is to get people to understand, if this is where we want to be, here's where we are. There's a gap. How do we close that gap?
How does leadership, give me examples of leadership and how much of that vision right now is shared?
Okay. From a national perspective, I would say the vision is not shared very well at all. However, when you look in regions of our country, particularly some states, you will find leaders who 30 years ago decided that to improve the health of the people in their community, and I do mean health, they focused on behaviors, they focused on keeping people in school, they focused on trying to even improve social circumstances. But they also did it with the mindset that our goal is to try to help people stay healthy. If we can't keep them healthy, we're going to cure conditions when we can. Mm-hmm. Can't cure everything, can't cure diabetes, can't cure asthma. For those things we can't cure, we're going to keep them well. And to keep them well, you might need very aggressive new models of care where we are using the active ingredients we already have, and we are using them on these patients on an ongoing way. So here's what happens in those communities. Community leaders, frequently they are physicians, they're hospital administrators, they may even be insurance people. Some cases we have of that. There are community workers. They have come together and said, we're going to change the care in this community, and they band together. They don't own each other. They just work together with a common electronic record. Frequently, they start their own insurance company. When they do that, then when patients sign up for that insurance company, I'm thinking of Grand Junction, Colorado, for instance, the whole community band together in '93 and created an insurance company. There were 3 hospital systems, there still are, and all the doctors were independent. They went to a single electronic record. When that happened, they can focus on their sickest patients and practice any way they want.
Back to the art of the possible. Is it possible for that vision that works apparently pretty well in Grand Junction, Colorado, to work across the entirety of the United States?
Absolutely. There are currently now 110 integrated delivery systems like Memorial Hermann, like Banner, like Kaiser, like Intermountain Clinic. There's 110 of them who own their own insurance companies. They have Medicare Advantage plan, Medicaid Advantage plan, or commercial plans for people under age 65. Now, you wonder, well, how important is that? Is that if regular insurance won't participate in paying us in a way that we get to be viable by keeping people healthy. Right now, in the fee-for-service model, we only make money when people are sick. If you want to change that new future, we have to change delivery models and payment models. Some providers have said nobody will participate with us, so we'll do it ourselves. Other places are seeing partnerships come up. However, but let me give you just a couple of examples of what can happen when a patient finds themselves in an insurance company owned by a provider system. When they're sick, they may very well get hospital care at home. They come into the home. Where? Albuquerque, New Mexico, Presbyterian Hospital with their Medicare Advantage plan.
Interesting.
They've been doing that for almost 13, 14 years. That's just one example. There are other examples where they will get independence at home programs where the providers, most of the cases, these will be community workers, they may be nurses, occasionally doctors, who will come to your home and make sure on a regular basis that you're following the medications. If you have asthma, that your house is clean. Occasionally, they'll even then hire a cleaning service to clean your hospital, your home, to avoid you getting a flare of asthma and ending up in an emergency room or in a hospital.
Right.
We have examples all over the country like that. If we would focus on learning from the examples and getting our leaders to say, here's a vision. Now, instead of the leaders saying, here's how you do it, don't do that. You look around the country and say, who's doing it? Who's already there? And let's learn from them and replicate those examples. I am totally confident that we can do it, and it's been coming over the last 10 years. We see it more and more.
We got about a minute left here. So we're talking about changing healthcare through those who deliver healthcare. You say that there is a bit of a shared vision out there. You say that it can be done. It's being done in little pockets. Give me a timeline. When could this happen, with real substantive change?
If the federal government would begin to pay in a way that providers who provide the best outcomes, best safety, best service, and lowest costs, and you pay them in a way that they can stay in business, we would change this in a year. Access
would be as strong, if not stronger, for everyone, even the poor?
Yes. It would be saving money. If we can save 1/3, and most estimates are there's 30% waste in healthcare delivery, that's $1 trillion.
Rescuing healthcare, a leadership prescription. This is really interesting stuff. It's something to think about. Good to have you on the show again. Good to see you again.
Thank you very much, and you're welcome. Thanks for asking me.
You bet. The BP oil spill in 2010 caused billions of dollars worth of damage, but how to put a price on the damage to natural assets that don't have a market price? Our next guest, Kerry Smith, was a part of a research project that attempted to do just that. Welcome to Arizona Horizon. Good to have you.
Thank you, to be.
This was like over 87 days, 100 million, a lot of oil.
A lot of oil. The largest maritime oil spill in U.S. history, 134 million gallons.
And how much damage now do we know in terms of what you can put a price on things? How much damage?
We estimated, a team working for the National Oceanic and Atmospheric Administration as part of a damage assessment under the Oil Pollution Act, estimated $17.2 billion
My goodness.
as the amount that households would pay to prevent another oil spill like this one in the Gulf.
That's an interesting metric because, because that includes the things that you can't put a price on. People are putting a price on it themselves, correct?
That's correct. That's exactly right.
By way of a tax?
Well, what we suggested to individuals was that they would be taxed in a one-time tax to develop a plan that would prevent an oil spill just like the Gulf spill. And so that tax was varied randomly across households in the United States that were part of our survey. 3,600 or so households were part of our survey.
And for those who kind of poo-poo this idea, no one's going to be willing to pay a tax for something like this. We have some visuals, some shots of the spill itself, the fire and the spill. There's the fire, which is just, you know, terrible to see. And as far as the spill is concerned and the damage done on the coastlines and the impact of that, we have a map coming up here shortly of the impact of the damage.
Mm-hmm.
I mean, when you were down there, you're willing to pay $153 to keep something like this from happening again.
That's right. That's exactly right. These households are clearly willing to pay that amount of money. The responses that households gave us to this survey are completely consistent with the types of decisions they would make in ordinary purchases of goods and services. What's different in this case is people may not even be using the Gulf and they want to protect it. So that's what's important about this study.
Now, the consent decree on all this, you know, you don't take any responsibility for this, but you agree to pay X, Y, and Z, included $9 billion for natural resource damage. According to your research, that's like half of what they probably should have paid.
It's smaller than what they should have paid, that's correct. Now, they also paid a total of, including the 8.8, of about $20.8 billion in cleanup costs, in payment to states for losses that the states may have incurred. And this does not include the payments that they made to hotels and commercial entities that also lost because of the spill.
But that $9 billion was specified for natural resource damage.
Damages.
And again, from an interesting point of view, you kind of came around the other area and said that damage was much more than $9 billion.
We said that people would be willing to pay much more than $9 billion.
But that's the market. The market spoke.
This is right. This is right. The assets are worth a lot more than $9 billion.
Has this kind of research been done on this kind of a thing before?
Well, under the Oil Pollution Act of 1990 and legislation prior to this, it is required that if oil is released into the natural environment, that these kinds of assessments be done. So, for example, there was an assessment done for the Exxon Valdez oil spill, and there have been other assessments, not on this scale, because this was the largest of the maritime oil spills.
Are these particular assessments, do they hold up? I mean, do they hold up in court? Do they hold up in agreements and arbitration?
They hold up in agreements and arbitration. Very few ever go to court. So the Exxon survey and the results from that was also part of a federal settlement. Most of these are settled before going to court.
All right. So again, this was the in the Gulf of Mexico, 134 million gallons spill back in 2010, and just horrific damage. As far as your research is concerned, and again, that when we look at this map, I mean, it's hard to imagine just how much oil that is. Just the absolute nature of this. Does something like this? How does it affect the real world? Are the oil companies paying attention to this kind of research?
I think they are, yes. They're beginning with the Exxon Valdez oil spill. This was an area that was not heard of by oil companies, and now they have experts on their staff to evaluate these kinds of decisions, to evaluate this kind of analysis, and to take seriously the measures that they need to take to protect the public from these kinds of spills. So it is having a difference.
And how did you get involved in this particular study?
I've been working in this area for nearly 50 years.
My goodness.
Not on oil spills, but in the context of valuing the environment and taking account of people's values, even though they might not use it, but care about it.
And to find out how much they care about it, you ask the questions. To find out how much they care about it. And you get the number. We design the surveys, that's right. It's really fascinating stuff. Good to have you here. Thanks for joining us.
Thank you very much. Thanks for having me.
And coming up Tuesday on Arizona Horizon, an update on the Tempe Streetcar Project, which just received $50 million in federal funding. And we'll hear what folks in Wickenburg think about a proposed interstate that could run right through their town. That's 5:30 and 10 on the next Arizona Horizon. That is it for now. I'm Ted Simons. Thank you so much for joining us. You have a great evening.
Arizona Horizon is made possible by contributions from the Friends of Arizona PBS, members of your PBS station. Thank you. When you want to be more informed, Arizona PBS delivers news and analysis with multiple perspectives, thanks to financial support from you and
The Persian Room. Travel to another world.